Politics in the times of pandemic is on center stage. Once again, there has been an intense blame game between the Delhi government and the centre over the ongoing oxygen crisis in the national capital. Now, the Bharatiya Janata Party's IT cell chief and co-in-charge of West Bengal, Amit Malviya, blamed Delhi Chief Minister Arvind Kejriwal for the oxygen crunch in the national capital. Amit Malviya cited a Delhi High Court order, said that the centre had sanctioned funds to set up 8 pressure swing absorption plants for oxygen production. So far, only one plant has become operational. The Congress blamed both the centre and the Delhi government for the oxygen crunch. The Congress party's General Secretary Ajay Makan said that the Parliamentary Standing Committee for Health and Family Welfare had advised the centre to maintain oxygen supply to hospitals in February itself, and yet no action was taken. And in court, it was the Aam Aadmi Party that said that there will be a huge crisis in Delhi if steady supply and promised 480 metric tons that was allocated oxygen was not supplied to Delhi hospitals.
ये 21 नवंबर 2020 को ये रिपोर्ट पार्लियामेंट के अंदर चेयरमैन राज्यसभा को दी गई और फरवरी के अंदर ये पार्लियामेंट के टेबल पे रखी गई। तो आज हमारे देश की राजधानी में ऑक्सीजन की कमी की वजह से इतने लोगों की मृत्यु हो जाए और समय रहते उनको चिताया गया। यही मैं अब आप लोगों को बताना चाहता हूं कि ये 190 पेज की रिपोर्ट में जहां पे ऑक्सीजन 40 बार मेंशन किया गया है, इसके अंदर समय रहते हुए हमारे पार्लियामेंट्री स्टैंडिंग कमेटी ने सरकार को चिताया था बार बार कि आप इसको ठीक करिए, ठीक करिए, ठीक करिए, लेकिन सरकार के कान पे जू नहीं।
So there have been failures at multiple levels, and let's take a look at them. As far as the central government is concerned, they failed to read the warning signs of this approaching second wave. The centre gave the impression that the worst is behind us. They failed to preempt this vaccine shortage and ensure adequate supply. They also failed to use the case dip to universalize vaccination for all, failed to implement lessons of the first wave to bolster resources for known possibility. It was well known that there would be a second surge. The centre also failed to anticipate the dangers of the mutant strains, negating previous preparations completely. But this is where the centre failed. What about the states? Let's take a look at where the states failed. The states failed to strengthen their health facilities despite important lessons being learned from the first wave. They failed to anticipate a spike in demand for oxygen, and they failed to come up with a proper plan. The states also chose to dismantle the temporary COVID facilities that had been set up after the first wave, and had these facilities still been in place, it would have sincerely and would have actually helped in the second wave. They also failed to create plasma bank. They played vaccine politics instead of a constructive and focused engagement. The states also chose to blame the centre when they failed to contain the spread at their level. What about the opposition? Where did the opposition parties fail? The opposition parties continued to play vaccine politics. They sparked vaccine hesitancy, as is alleged by the centre in states like Chhattisgarh. They spread fear in the minds of public about the effectiveness, about the efficacy of the vaccines. They conducted mass political rallies like the centre. They criticized the BJP for doing so, but they did exactly the same themselves. So a very angry Delhi High Court today said that they will hang the man who's responsible for blocking oxygen supply. And this just indicates how frustrated the learned judges at the High Court also must be to see this intense blame game that has been on. And this intense blame game between the centre and the states is actually resulting in people of Delhi gasping for oxygen, and some even dying in hospitals because of this oxygen crisis. Joining me on the show, Syed Zafar Islam, Member of Parliament and spokesperson of the Bharatiya Janata Party. Adil Singh Boparai represents the Congress Party, and Reena Gupta is the spokesperson for the Aam Aadmi Party. And Syed Zafar Islam, I want to begin by asking you, sir. The Delhi government says the system will collapse if Delhi does not get the promised and allocated 480 metric tons of oxygen. Hospitals today are overwhelmed. They are living literally from hour to hour and the government in Delhi says this is a disaster waiting to happen. The centre needs to deliver. Sir, why is the centre failing?
Gaurav, I think the observation of the Honorable High Court is loud and clear. The responsibility of the state or administration is something which they are escaping from. It is the responsibility of the state government once the allocation has been made by the central government, and which the Honorable Chief Minister of Delhi, who is making this kind of drama, he has also thanked the central government. Then he should make the preparation for the allocation which has been made for Delhi, to take that allocation and distribute it in timely manner to all the hospitals. But
Okay.
they are just doing the lip service. They are not making any effort, and that is what the observation of the
Okay.
Honorable High Court as well.
Reena Gupta, the court asked, what has Arvind Kejriwal government done once they got this allocation of 480 metric tons of oxygen? Did any effort be made to get the containers? Did you work the phone lines to reach out to other chief ministers? Or is Delhi only waiting for centre to do all the work, ma'am?
Gaurav, Delhi government has been working overnight to ensure that oxygen reaches the Delhi hospitals. There is a 24-hour war room that has been set up, which is on the phone constantly with all the states and with the vendors and suppliers. But having said that, it is one thing to increase the quota on paper. I'll give you the data. On 22nd April, we got only 177 metric ton out of the 480 metric tons. Yesterday, we got only 290 metric tons out of the 480 metric tons. Again, so increasing the quota on paper does not mean anything if the oxygen is actually not reaching Delhi and not reaching the hospitals. And the reason being that the governments of Haryana and UP are not allowing the tankers to leave their borders. And this is not me, a spokesperson for a political party, saying that. You have seen all the owners of reputed hospitals of Delhi have publicly come out and pleaded and said that please allow the oxygen to leave Haryana and UP so that it can reach their hospitals.
Okay.
Now, this is where one has to understand that oxygen is a regulated commodity in the country, which essentially means that the central government decides the quota. The central government also decides from where this quota will be fulfilled. For Delhi, most of the quota is being fulfilled by plants in UP and Haryana.
Okay.
But if the UP and Haryana states are not letting the tankers leave their borders, how will it reach Delhi?
Adil Singh Boparai, the centre says the Prime Minister Care Funds have been used to set up, for example, this 500-bed DRDO hospital in Delhi. 3,800 beds have been added in government hospitals from 1,090 beds. The government says aircraft have been sent to Singapore to bring in cryogenic tankers. Steps are being taken, but numbers are too high. Adil Singh Boparai.
We got it first and foremost, for the first time in the history of independent India, you've had doctors and hospital owners approaching a constitutional court seeking directions against the centre to restore oxygen supply. Now, the same very Delhi High Court and the same Bombay High Court have also held that the responsibility or the duty to supply oxygen rests squarely on the centre. So therefore, Mr. Narendra Modi cannot shirk or evade responsibility, point number one. Point number two, as far as the Congress ruled state is concerned, Punjab made a request for setting up 2 oxygen plants to the government of India in January of this year. That request is still gathering dust. Number 3, which is extremely critical, at a time when we were on the cusp of the second wave, at a time when all experts were telling us that the second wave will be more virulent and potent, the government of India exported oxygen. The government of India exported vaccines. What is more important? The banner of your debates are India first. Was it not important to vaccinate Indians first? Was it not important to keep oxygen for India first? Was it not important to keep antiviral drugs for Indians first? Now, Gaurav, being in Delhi, the shortages are amplified, but let me assure you that the shortage of beds, oxygen and antiviral drugs is pervasive, not just in Delhi, but in Uttar Pradesh, in Bihar and in other parts of the country.
Oh, absolutely. Look at the number of phone calls you and I and everybody gets at this point of time. And Syed Zafar Islam, yes, you must come and you must respond to points that are being raised by Adil Singh Boparai. And let's take this step by step. Was it necessary to export vaccines? Was it necessary to send out oxygen? The points that the Congress party raises, why was the oxygen plant in Punjab not cleared when they requested you in January? 3 points raised. Please respond, sir.
First of all, Mr. Adil must know that when he is talking about the vaccine being exported, then he also must understand that the countries which are giving the raw materials which is being used for making this vaccine, they will stop this raw material also, because they will say that if you are not exporting us, then we will not give you the vaccine, those raw materials, because we have imported those raw materials from other countries with the condition that we will export. Even though when the situation, when the cases had surged here, we had gone back to those countries and said, look, we had committed to you, but right now we need more in India, and those countries have agreed because the situation is different compared to their countries. So they must understand that all the facts before even making that kind of a statement. These inputs has come from, or the raw material has come from different countries, and with understanding that these vaccines will be exported to those countries, because we do not have those raw materials in our country, and we cannot prepare vaccine or make vaccine unless those raw materials are being sourced from these countries. Secondly, the Delhi government has been given, Chhattisgarh government has been given lot of support from the center. But what is the situation? All these government actually only have a habit of criticizing the central government and not doing what is, or discharging their own responsibilities. And that
I'll come to Chhattisgarh and the allegation of increasing vaccine hesitancy. Sir, the brevity has to be afforded just now because there's a paucity of time and issues are many. And Ms. Gupta, the point that's being raised by the Bharatiya Janata Party and also which was raised in court is if there is surplus 15,000 metric tons of oxygen in the eastern part of the country, what effort did the Delhi government make, like other chief ministers are making, to reach out to chief ministers there, arrange tankers and get oxygen from there to here? Was any such effort made, ma'am?
Gaurav, such efforts are being made constantly. We've been calling all the chief ministers and all the vendors, but one has to understand that Delhi is not an industrial state. So we do not have our own tankers, and this is where one needs the central government to step in. Why do we have a federal structure? Why do we pay taxes to the central government? Because when in the hour of need, you need the central government to come in and help with things that you don't produce in your own state. That is the beauty of the federal structure. So it's very sorry state of affairs that whenever the central government wants credit, then, when they wanted credit for the vaccines, then they were very happily putting up the Prime Minister's photo on the vaccine certificates. But when, the state government needs the help, they're very happily coming on TV channels and saying state is health is a state subject. No, sir, it doesn't work that way. If you want credit, you have to take responsibility as well.
Syed Zafar Islam, 15,000 metric tons of surplus education in the eastern part of the country is what was submitted in court today. Be that as it may, why did the center not help Delhi or Mumbai, for that example, if these places are facing this acute crunch and people are dying, and you blame Delhi government of being incompetent? Sir, but people in Delhi are dying. What effort did the center make to get that oxygen from the eastern part of the country to these Delhi hospitals that are literally gasping for breath, sir?
Gaurav, you have to understand the responsibility of both center and state. If you can recollect, when the first wave was there, that time also Kejriwal government was doing nothing. It is the central government which has intervened.
Sir. Let's talk about today. Let's talk about today. Let's talk about oxygen. Let us not divert. Let us talk about oxygen and today and what the center is doing.
One by one.
You must listen to. You will not be able to hide your inefficiencies, please. Let me tell the truth also. That time, the Honorable Home Minister intervened, provided every possible support. After that, what did happen? He is only spending money on advertisement. So ask her what is the January budget on advertisement, where Kejriwal, even 7 days ago, Kejriwal is making a statement saying we are absolutely in a comfortable position. Everyone has heard. He is making a statement that we do not worry, we have everything available here in our state. He should have made that statement. He should have ascertained what could be the potential requirement. He didn't do
Before I bring in Adil Singh Boparai, Ms. Gupta, quickly, the point that the BJP is raising is 27th of August 2020, Arvind Kejriwal government said people will get oxygen at home. What efforts were made to ensure that? You know, the BJP raises the point that the Delhi government was given clearance to set up 8 oxygen plants to generate medical oxygen in April 2020. This is April 2021. How many of these plants are operational, ma'am?
Gaurav, in April 2020, the Central Medical Services Society put out a tender for installing 150 medical oxygen plants all over the country. They chose one vendor, one single vendor, to install those 150 plants. The result being, in the whole country, only 6 plants have been set up. No money was given to the Delhi government. In fact, the Delhi government has been writing to them saying that the plants which were sanctioned for Delhi, why have they not been put up? But the vendor has run away after installing only 6 plants. So this question needs to be asked, that why was this one vendor chosen for installing 150 plants all over the country? And only 6 plants are functional.
7-8 months. See the advertisement budget. See the advertisement budget. No state government has spent so much money only on one individual. It is only Kejriwal who has spent this kind of money.
Adil Singh Boparai, does Delhi government too share the blame? Courts have said the problem is you think allocation is done, everything will be served at your doorstep. That's not how it works. What efforts, and is this something that the Delhi government needs to answer? What efforts were made by the Delhi government to ensure tankers were arranged to collect oxygen? Railways, according to the centre, kept waiting for tankers from Delhi. No requisition claim. At least that's the claim that's being made.
Well, Gaurav, before I respond to that question, there's something very objectionable which has come to my light. A constitutional functionary, the Solicitor General of India, Tushar Mehta, says in court, please do not be a crybaby. Now, the Congress party has several differences with the Aam Aadmi party. The Congress party holds the Aam Aadmi party equally responsible as the BJP. But is this appropriate for the central government to tell a state that do not be a crybaby? To tell citizens of this country who are gasping for breath, who are dying because of lack of oxygen, not to be a crybaby? Is this appropriate? We can have different political allegiances and political affiliations, but is this appropriate? Point number 1. Point number 2, Gaurav, there is a distinction between an allocation on paper and actual supply. Now, as rightly pointed out by Justice Vipin Sanghi of the Delhi High Court 2 days back, beg, borrow or steal, but please ensure that oxygen supply reaches the hospitals. Unfortunately, the government of India has miserably failed. Now, much is being said that the state should have taken responsibility. I must remind Zafar Saab, now that he's a member of parliament, that under the Epidemics Act and under the Disaster Management Authority Act, the nodal authority is the Ministry of Home Affairs. Now, if the states want to speak to the nodal authority, they will speak to the Home Minister. But unfortunately, the Home Minister is busy with elections in Bengal. Amit Shah was conducting 3 rallies yesterday in Bengal. So the states are left to fend for themselves. Whom do you coordinate with, Gaurav? Whom does the citizen of the state coordinate with?
Syed Zafar Islam, respond. Sir, you are the government in power. You are the center. You are at the center. People in Delhi are dying, irrespective of who's competent, who's incompetent. Sir, it's your responsibility to provide 480 metric tons of oxygen to Delhi, and then whatever issues may be there can be sorted out subsequently. I mean, hospitals are literally on their knees telling people, please discharge your patients. We don't want them to die inside hospital. Sir, kuch to solution nikalna chahiye. Yes, Syed Zafar Islam. Please respond, sir.
See, there are many other states who also needed oxygen supply. Like, for instance, Uttar Pradesh. See the kind of system they have put in place. They are tracking every movement of the tanker. What efforts the Delhi government has put in? They have put in a system to ensure that the movement will be tracked, and all hospitals allocation, whatever the allocation that the state government has made, that will be supplied and it will be monitored by the authorities there. So what efforts, such efforts have been made by the Delhi state government and the representative? They are only their only intent is
Sir,
to
we can have a
blame
blame
central
game
government.
later, sir. We
No,
can
no,
have a
no,
blame game, but just now oxygen needs to be supplied. Everything needs to be done to supply oxygen to Delhi. Sir, जिंदा रहेंगे तो लड़ भी लेंगे, लेकिन जिंदा तो रहे और उसके लिए oxygen is required.
That's why Honorable Prime Minister has convened a meeting this morning. All this support which the state administration and state government requires is being given to them, but they need to move. They need to move also. Even whatever is being given to them,
The
they must
center
collect.
and the states need to move together. I've run out of time on this part of the show. We'll track the story very closely. Sincerely pray that the center, the states, the administration, they work together to ensure people in Delhi and people of our country can survive this pandemic. To all my guests, many thanks for joining me.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.